Aid from the UK and other countries is on its way to India as the country struggles with what's been described as a tsunami of COVID cases.
Yes, hospitals are running out of beds, crucial oxygen as well. People literally begging, borrowing and even stealing supplies for loved ones. Well, joining us from Delhi is journalist Nilanjana Bhowmick, who calls the last few weeks the worst of her life after her whole family caught COVID and struggled to get any help. And in London is Dr. Mike Noyes from Action Aid, who says the UK government must do more. Nilanjana, tell us what happens when you are there in Delhi, your family is diagnosed with COVID. What kind of help are you able to access?
Well, first of all, when the news came, when I got tested on April 15th, because I had really high fever and body ache, and it was obvious, because the country was already, we were experiencing rising cases, and I isolated myself immediately, and I got a test done, and it was positive, and of course the doctor said that the rest of the family has to get tested as well, and my biggest worry was that my 75-year-old, both of my parents, they're 75 and they are currently staying with me. And I was extremely worried about them because the bed shortages and the oxygen shortage hadn't started at that point of time, but there were bed shortages. Basic medicines were not being, not available in pharmacies. So I got tested, my entire family got tested, and they were all positive, including my 15-year-old son. But my parents have had the first dose of the vaccination, so maybe because of that, their infection was quite mild to begin with. But my father, who suffers from Parkinson's, and his oxygen saturation levels started dropping. Now, at that point of time, already, the shortages had started in earnest, and as you said, it was the worst few couple of weeks of my life because I was constantly making this list, going on social media, because by that time it was pretty obvious that we were all on our own. There was no state support. We didn't know which way to turn. And as I keep telling everyone that, I'm a journalist. I have worked most of my life in India and I have contacts, and I was so helpless. So I actually I couldn't even think about what was happening to people who did not have the resources that I had access to. And believe me, even with those resources, I had zero hope of getting my father admitted in a hospital or even get him oxygen. And the whole point is that even if I as Dr. Hillary said in the discussion earlier, and he's so right that even if I can get oxygen, can I really administer it to him? No, I would need a hospital bed for him. And the hospital beds were not there right from the beginning.
Yeah. So what is happening, Nilanjana, what is happening? Because as you say, people are in situations where they're having to beg for help on social media. I mean, putting out tweets asking for help. What is the situation where people are unable to get access to medical help unless they can pull some sort of strings or access something privately? I mean, if you turned up at a hospital, for instance, today, what would happen?
I did turn up in a hospital, last week, because when my father's oxygen levels kept dropping, the doctor said that, you need to go and get a scan done, a lung scan done. And I went to the hospital with him. I was, he has a lot of comorbidities and he's recovering from a very bad illness last year in the middle of the lockdown. And I went there and I got his scan done. And I was busy while his scan was getting done. I was busy talking to everyone in the hospital. It's a small hospital. It's in a residential area. And I thought I really had my hopes high at that point of time that maybe they would have a bed. And I kept talking to all the doctors and everyone, and they said that there are no beds available. And, by that time I have had compiled a list of almost 50 hospitals, and I had been calling them, throughout the day, and nobody had any any beds available. There was a central helpline where nobody picked up the call, and that's exactly it. I think there is a lot of panic that's happening at the moment as well. But and the government from the very beginning of the second surge, they have blamed it on the people for the surge and for everything. But can you really blame the people when they know that they have no access to anything? They are left on their own. They are going on social media. They're asking for help. They're not even pulling strings. They're merely asking for help. That please help us with like with leads, with anything that you can do. We are not pulling strings anymore.
Desperate situation.
Yeah, we are
as you say.
We are just sending out desperate pleas into the universe, hoping that someone would come to our rescue. And that's exactly like what is happening at the moment. We are sending out desperate pleas to the universe.
Yeah. Mike Noyes, you are head of humanitarian response at ActionAid. I mean, one of those desperate pleas could be answered by the UK government. It is sending some equipment. But what can we do? I mean, India manufactures and sends out vaccines. Is there a point at which we say, we keep it for yourself?
I think there's a lot of things we can do in here. I mean, the release by the government of some medical supplies, some ventilators and the like is excellent. India's a big country. We probably need to see if we can do more just on that technical side of things. But I think the other thing we have to remember is that what we have to do, as we learn from ourselves here, is to break the cycle of transmission. The situation in India will only get worse if the focus is purely, and it has to be done, but if the focus is purely on the medical condition of those that are sick now. Breaking the cycle of transmission, as we know, is the most important way to bring this under control. Talking to my colleagues in ActionAid India, what they're telling me they need right now is money. Money to help people stay at home and stay in quarantine when they're sick. Talking to our country director, Sandeep, who himself is isolated at the moment because of this, he says this is the most important thing they need. So many people in India live on a hand-to-mouth basis, a day-to-day basis, and helping them stay in quarantine when they are sick, when they have to self-isolate, as our colleague Nilanjana was saying just then, is vital. But you mentioned vaccines, and vaccines too are really important. What we see now, of course, is that India is a major supplier of vaccine, but India is bound by patent regulations to only produce what drug companies allow it to. And the world needs this right now, is a global waiver on the patent protections for vaccines so that everyone can get it. It's no good the UK being vaccinated if the rest of the world isn't.
Yeah. Nilanjana, just to come back to you then. So, we've seen these pictures of patients. I mean, they're not even patients yet. They're just visiting the hospital. They haven't even been registered as patients. They're sat outside the hospital in their cars. A lot of health quantifiers have said that if this continues, we could be at 13,000 deaths a day by the middle of May. The doctor's point there is that we need to break transmission. Now, in a country that has allowed political rallies, that has allowed religious festivals, the Kumbh Mela took place, 1 million people, Kumbh Mela. We know that lots of workers are going back to their families in villages that yet haven't had big breakouts, may potentially now get breakouts. Is the message getting through now? Has the government stepped up and said, right, we need to break transmission? There are restrictions, there are travel restrictions, there are stops on weddings, on political rallies. Is this happening across India or not right now?
I think, the government has stepped up, but it might just be a case of too little, too late, because this is a politically made disaster. Let there be no confusion about this, because we knew of the new variants way back in January. The UK variant was already identified in Punjab, where cases were rising, and in Maharashtra we identified a homegrown variant B1617, and the moment you identify new variants, you move resources to those areas because you try to contain those infections over there. But saying that, the reason, I'll explain why I say that this is a politically made disaster. It's because in March, our health minister came on record to say that we were in the end game of COVID-19 pandemic. I mean, how did he say that? What was the scientific basis of that comment? Because world over, we have seen that the rest of the world was already going through second waves and third waves and much bigger waves, than the first ones. Yes, we escaped lightly, last year, but everybody, even domestic experts have been warning of second waves. They have been shouted down. The people were saying that don't be negative. I have had people come up to me and say, oh, what's corona? Where is it? There is no corona. It was like just some, it was just a flu. It's a seasonal thing. And I think, that's the same world over. Like, there is, there are always, like
of
people
course,
who
yes.
would say things like that.
But people need to take it so seriously, and your family has obviously experienced it. But I understand your family's recovered now. Your father's okay. So we're grateful for that. But clearly, for other families, still desperate scenes there in India.
Absolutely.
Nilanjana, thank you so much for joining us, and Mike Noyes as well from ActionAid. Thank you both.